Hello, my name is Carlene and I'm your nurse today. I'm going to verify your name and date of birth. You're just going to squeeze my hand if I'm correct. Your name is Jane Doe. Your date of birth is July 22nd, 1960. Okay, great, you answered correctly. I'm going to start asking you a few questions. For the first question, you're going to squeeze my hand every time you hear the word A. I'm going to start now. S, A, V, E, A, H, A, R, T. Okay, very good. My patient's RAS score is 0. I'm going to ask you the next set of questions. You're going to squeeze my hand every time the answer is yes. Will a stone float on water? Are there fish in the sea? Does 1 pound weigh more than 2 pounds? Does a hammer pound a nail? Can you hold up 2 fingers with your opposite hand? Very good. Can you hold up 2 fingers with the hand that I'm holding? Very good. Thank you.
As you're doing your BCAM assessment, the first section is the Richmond Agitation Sedation Scale, the RASS. You're going to rate your patient's RASS score, which in this case, the patient is a 0, alert and calm. Then you're going to move on to the next section, which is BCAM for 65 and older. So you're going to answer the questions regarding mental status. Is it at baseline? Which in this case, this patient is at baseline. Now, this ends the assessment here because she becomes delirium negative. She's BCAM negative.
My patient's CAM ICU is negative. No signs of delirium. Hello, my name is Carlene. I'm going to be your nurse today. I'm going to ask you your name and date of birth. If it's correct, you're going to squeeze my hand. Your name is Jane Doe. Date of birth is July 22nd, 1960. Very good. I'm going to ask you some questions. The first question, every time you hear the letter A, you're going to squeeze my hand. S, A, E, V, E, A, H, A, R, T. Very good, thank you. I'm going to ask you another set of questions. Every time the answer is yes, you're going to squeeze my hand. Does a stone float on water? Does a fish swim in the sea? Does 1 pound weigh more than 2 pounds? Does a hammer pound a nail? Can you hold up 2 fingers with your opposite hand? Okay. Can you hold up 2 fingers with the hand I'm holding? Okay, thank you.
In order to perform the CAM ICU, what you're going to do is open up the documentation and first perform the RASS score. So as you look at the RASS of your patient, you're going to see where they fall into place. When they're intubated and sedated, there's going to be a particular amount within the order that you for their sedation level. So that's where you should be as you perform your assessment, assessing what their RASS level is. So if their RASS for this patient is a -2, that means they're lightly sedated. They briefly awaken their eyes with eye contact to voice. Next, you're going to move on to the mental status. Is their mental status at baseline, or is there an acute change from present mental status, or is it fluctuating? Now, just because somebody is intubated and on sedation does not mean that you can't perform the CAM assessment. The times that they would be unable to assess is when they have a very deeply sedated RASS score, or they are also paralyzed on a paralytic, and you're unable to perform the assessment because we're not waking them up. So you move on to your assessment, see where they fall for their mental status. That next we move on to their their disorganized thinking and seeing if they're inattention they're inattention, and see how many errors they've made. If they've made more than one error, you're going to say okay to the greater than one error, and that's where you're asking them to spell that save a heart and how many letters times that they're squeezing for the letter A. Then we move on and again fill in that same RAS assessment for your score. So we had a -2. And lastly, you move on to the disorganized thinking, where you're asking them particular questions, and you can tell them to squeeze your hand or shake your head, or utilize the pictures and have them point. And then it will come up with what your score is, whether they're CAM positive or negative, based upon the assessment.
My patient's CAM ICU is positive. I'm going to notify the provider.